Welcome to Medical Marijuana and Wellness. I'm Marc Matoza, and today we're going to be talking about arthritis. So, what is arthritis? Arthritis is inflammation and the breakdown of cartilage in our joints, our hands, our hips, our knees, and our spine. You can see that a healthy joint has a nice look to it with the cartilage in place, nice spacing. And when you get to osteoarthritis, you can see where the breakdown of cartilage is starting to cause some bone-on-bone type of rubbing, which again creates a lot of pain. Rheumatoid arthritis is again inflammation of those particular joints, which can cause a lot of severe pain, permanent joint damage, as well as disability. These conditions are also found in things like fibromyalgia and also injuries that you find from sports. How do we know we have it? Well, obviously joint pain, redness, minor swelling, and also the sensation of heat that we find in our joints themselves. What can medical marijuana and arthritis do? Well, cannabis cannot cure it, cannot cure arthritis, not going to reverse it, and also you're not going to have any fatal overdose from using it. What cannabis can do is reduce your level of pain. It can reduce the inflammation and pain associated with the inflammation of arthritis. It can help you with your overall physical health and also help you with your anxiety and stress. Now, how do we know this? Well, the Journal of Canadian Research, Cannabis Research found in Canada, found that 83% of the patients that they looked at found improvements in pain by using CBD. They found that 66% of those patients had better physical function and 66% had better sleep quality. We also found from the Canadian Arthritis Association, again, a study that was done by Dr. Noel, that cannabis isn't going to cure arthritis or slow it down, but can help a lot of people with both the pain and inflammation. And again, this is important studies that just recently came out in 2022. Harvard has told us that 1 out of 5 people that were consulting a physician, again, part of the Canadian research study, found that 9 out of 10 of them say it was effective in managing pain. 4 out of 10 of them found that it decreased their reliance on other pain medications, and 6 out of 10 of them found out it was more effective than any of the pharma drugs that they had been taking. Looking at the Arthritis Association here in the United States, they found that 79% of the folks that they were looking at were using CBD. And of that study, that they found that 71% of them had improvements in sleep, 94% of them found it helped with relieving pain, 67% found that it improved their mental health, and also they found that only 66% of these patients talk to their doctors. And I think it's important to point out that you should let your doctor know that you're using CBD and or medical marijuana. I think it's important for him to know. But again, some doctors are a little reluctant to doing that, and I understand why that statistic is the way it is. Looking at the PubMed research, PubMed is what your doctor uses in order to be able to determine what products they should be using. They found out that there's over 100 different articles about medical cannabis and arthritis, and they found it, again, SAFE, which is the Americans for Safe Access, have found it is extremely important to be able to use cannabis to help reduce that morning stiffness and inflammation. So research studies have backed this up, but what's the big deal? Why does cannabis work? Well, we know we have a nervous system. We know that if we hurt our finger, we bang our knee, the nervous system sends us, from that particular part of your body, sends a signal to your brain and says, Houston, we have a problem, of which your brain then processes it. The question then becomes, what does Houston do with it? We found out by researching medical cannabis about 25, 30 years ago that every human body has what they call a endocannabinoid system. This endocannabinoid system directs and manages the processes of our body, the pain, the anxiety, memory, appetite, inflammation, and also our immune system. This is how your body manages itself. When you say, Houston, I have a problem, the researchers were trying to find out what neurons were being affected, and what they ended up finding out was we have a whole system, the endocannabinoid system, that helps us be able to keep our body in what they call homeostasis. Homeostasis is our body in balance. Our body in balance means we feel good. So how does cannabis affect homeostasis? Well, what we found out is in our body, because we produce endocannabinoids to be able to address the different issues related to our bodies. So when your body has a problem, it generates endocannabinoids, sends those endocannabinoids to that part of the body to be able to relieve or to address that particular condition or problem. What they found out is that phytocannabinoids exactly mimicked endocannabinoids. In other words, they are replicas that can go into your body and actually address the same receptors and provide the same medical benefits as your endocannabinoids. Why would you do that? Well, turns out, for example, I'm a senior citizen. And as a senior citizen, I'm not producing as many endocannabinoids as I was before. But by being able to use or be able to introduce into my body some phytocannabinoids, what I'm doing is I'm giving my body the resources it needs to be able to do the job it wants to do, especially with the endocannabinoids. It's really, a lot of doctors will tell you, a lot of medical cannabis doctors will tell you that really anyone over the age of 55 should be looking at using CBD and or medical cannabis to help their bodies be able to stay in homeostasis. Now, we hear a lot about hemp versus marijuana. What does this really mean? Well, typically, hemp is 0.3 or less of THC in content. Now, that is how hemp is classified here in the United States, and that is actually a legal definition. It is not a genetic definition. So when we talk about hemp or CBD, hemp, it's 0.3% or less THC. When we talk about medical cannabis, it typically has more than 0.3 THC in it, and it's usually used for a number of different to treat a number of different ailments. What's the common use? Well, for many years, hemp was used for many years to be able to help build ropes, textiles, hygienic products, paper. But lately, we found a tremendous medical use for it, and it's getting in popularity. Hemp is a kind of a tall plant, where medical cannabis or marijuana itself is kind of a short plant, bushy plant, hence why they call it weed. Hemp is legal in the United States federally. Cannabis is not, marijuana is not legal federally. It's managed state by state in order to be able to find if you have the ability to access it and be able to buy those products. Now, what are the key components of cannabis? The cannabinoids are very important. These are the compounds that address your receptors, open up the receptors, and be able to provide, so they can provide, and your body can provide the medical benefit that it needs. The terpenes is what brings the aroma and also brings the taste to cannabis. And these terpenes have a lot of medical benefits. And when you say, what are the cannabinoids introducing into these receptors, it basically is a lot of the medical benefits provided by the terpenes and also by the flavonoids. Flavonoids provide not only the taste, but also provide the color and have a lot of medical benefits, including antioxidant and anti-inflammatory, their neoprotective, which is important. We'll talk about that later, and the possible disease protection. So cannabis has a number of 3 different components, and those components work together to create something called the entourage effect. And what that means is by the 3 of them working together, it gives you more benefit than using any one of them by themselves. An example is if you use CBD with THC, it'll lessen the psychotropic or psychoactive effects of THC, meaning it'll keep you from getting as high with THC. In fact, in a lot of cases when we're looking at dosing or first trying to figure out what your proper dosing level is, we recommend having some CBD around. So if you start getting some negative side effects, you have the capability of managing that. And naturally, terpenes enhance the medical benefits of cannabis, and also THC and CBD working together enhance their medical benefits. THC and CBD work much better than they work by themselves. That's an important thing to remember, and we'll be talking a little bit more about that. Now, what are the main cannabinoids that we find? There's CBD, which is found in cannabis and also found in hemp. It's not psychoactive, and that's because it addresses the peripheral organs and the immune system. We find that there is THC, affectionately referred to as delta-9. This is found in cannabis. It's found in quantities of 0.3% or more of marijuana or cannabis. It is psychoactive, and the reason it's psychoactive is because it addresses the CB1 receptors, which are in the brain and the central nervous system. This is very important because it helps relieve pain, it helps with anxiety and stress, and THC is very good for the overall aid in helping your body stay in homeostasis. But it has to work in many cases with CBD in order to be able to get the benefits that we're really looking for. Now, what are these receptors that we talk about? Well, there's CB1 and CB2 receptors that both THC and CBD address. These can be found in the immune system in the peripheral organs, CB1 receptors. CB2 receptors are found in our immune system and also in the nervous system. We've also found that CBD has an additional property, and it works with other receptors outside of what we refer to as the endocannabinoid system. What I mean by that is it works with the 5-HT receptor, which is a serotonin receptor that helps with breathing, blood flow, and our digestive process. The 2A2 receptor, which helps with inflammation and coronary circulation. VR1, which helps with pain, and also the GPR55 blood pressure receptors. So what we're finding is that CBD acts as, in essence, a supervitamin for our body, and both of them together really help to be able to bring a lot of healing properties to our body. Now, I put this chart in. I'm not going to really go through it. It's really for your reference. But I just wanted to point out that there's a number of different benefits that you're getting, not just from arthritis itself, but from helping with things like blood pressure, helping with things like mood, nausea, helping with pain, helping with mood disorders and also nausea and vomiting. And also it can help with various nervous protecting your cells, so that it's a neuroprotectant. It can help to be able to coat those parts of your body to be able to keep them in, hopefully, homeostasis. Now, how does this all work? One of the most important parts of this is to get a product, a cannabis product or a CBD product that has the right terpene profiles. As I mentioned earlier, the terpenes are what's introduced into the receptors that help you with provide the relief that you're looking for. And you can see there are receptors like caryophyllene and beta caryophyllene. Great for analgesic. What's an analgesic? It's pain relief. It helps with anxiety and stress. We have myrcene, which helps with address the inflammation. You'll find that pinene helps with not only inflammation, also it helps with pain relief. Limonene is also important, and also eucalyptol. So you can see there's a number of different terpenes that are involved or can help with cannabis itself. And caryophyllene and myrcene are the primary ones that people use to be able to address their particular condition. Now, one of the things about terpenes is they are heat sensitive. And what I mean by that is if you are smoking cannabis, if that's the form of cannabis you use, you have to really look at the temperature that you're setting on either the vape pen or on the dry herb vaporizer that's out there. And we'll talk about routes of administration in a minute, but this terpene profile and also the temperature rating is something that's very important to pay attention to get the maximum benefit out of the products that you're buying. What cultivars are being used? What do we mean by cultivar? Cultivar is a combination of a strain and also a terpene that's been now engineered to be able to address a particular situation. So we're finding that today, a lot of the dispensaries are going in and looking at addressing things like arthritis and pain and putting together products that address those particular conditions. Some of the strains that you'll see some of the product names that you'll see in stores are going to be AC/DC, Girl Scout Cookies, Harlequin, Cannasu, that type of thing. And you can see by the terpene profiles over here, a lot of myrcene, a lot of beta caryophyllene, and again, depending on what you're trying to address, it has a number of different effects that are out there. So there's a number of different strains that are good for arthritis. Again, pay attention to the terpene profile, the myrcene, the pinene, the caryophyllene. It can help quite a bit. How do we use it? This is the important question. A lot of people start using medical cannabis with sublinguals. And what's a sublingual drop? It's an eyedropper where you put underneath your tongue a certain amount of the medical cannabis in liquid form. When it goes underneath your tongue, it then gets absorbed on the blood vessels in the inside of your body, and that gets introduced into your digestive system. Sublingual drops typically take anywhere between 15 to 20 minutes to work, and they'll work between 4 to 6 hours, and that also applies to sprays that you might use for that route of administration. Routes of administration. What's the best way of taking medical cannabis? Well, a lot of people start by using sublinguals. Sublinguals are drops that you put underneath your tongue. Those drops get absorbed into the linings inside your mouth and actually then allow the cannabis to be able to absorb into your digestive system and through your blood vessels. Sublingual drops will take about 15 to 20 minutes to work. They last between 4 to 6 hours. And that, by the way, that goes for sprays as well. And it's probably the best way to start using medical cannabis. It's very easy to administer, very easy to measure how much you're using, and you can be able to find out, again, immediately if it's working within a half hour of when you start. Again, it has a 4 to 6 hour duration, so it can take you through a morning, take you through an afternoon, take you through an evening, and it's something that's very easy to control. Oral is interesting, or oral forms of routes of administration. They're probably some of the most famous because this is when your edibles, your gummies, your lozenges all come into play. The great thing about orals is, if you can see down here, they last a long time. They'll last 4 to 10 hours, whether that's a capsule, gummy, chocolate, whatever. However, be careful, because they can take between an hour and a half to 2 hours to work if it's a capsule. It can take between 15 minutes and 2 hours to work if you're an edible. So one of the things you got to be careful about is that edibles taste great. And in many cases, people want to eat them like Skittles because they taste so good. However, wait. Please be very patient, because about the time you think that they're not working is about the time that they start working. So if you're using an oral product, wait about an hour and a half, 2 hours before you take another one, just to make sure you're not taking too much of it and not getting a negative effect from using medical cannabis. Topicals are important because this is something that you put on the skin that gets absorbed into the skin and into the blood vessels. Now, there's two different types that you'll find that are out there. There are topicals, and there are also transdermal patches. Transdermal patches go directly into the skin and get down into the blood barrier, so they can actually have a little more effectiveness to be able to address not only the particular area that you're trying to address, but also cannabis in general, or some of the ailments that you have in your body. I'm a big fan of topicals. I have herniated discs in my neck, and I find that they work almost immediately, and you'll find that you'll get an hour or two of relief from using those topicals. Now, some folks look at inhalation as a way of using medical cannabis. Probably the most popular one is flower. Flower is great from the standpoint that you can use medical cannabis. However, it has a huge negative side effect, and that is that, remember we talked about those terpenes that are very sensitive to flames or to heat. If you get a joint and you take that flame, which is about 500 degrees or more, and you bring it up to that joint, what's happening is you're burning off about half of the cannabinoids, almost all of the terpenes, and almost all the flavonoids. In other words, you're reducing the efficacy of that particular joint by smoking it down approximately 60%. That's the bad news. The good news is it still works. I mean, how many times do you find an engine that runs at 40% capacity and still gives you some benefits from it? The best way to use dry flower is to use what they call the dry herb vaporizer. And the reason for that is because if you're smoking a joint, that's burnt material, and that burnt material can get into your lungs. Cannabis isn't as bad for you as things like cigarettes, but still, any amount of burnt material is something you have to look out for. I recommend using what they call a dry herb vaporizer. What that does is you put it into a device that actually heats up and steams that particular flower. You're not getting any burnt material, but you are getting all of the benefits from cannabis. And more importantly, almost all dry herb vaporizers give you the capability to set the temperature on that particular device, which is great for being able to maximize the benefits from using the terpenes that are there. Again, looking at that terpene table that's out there. Now, in many cases, because people don't have dry herb vaporizers, a lot of the dispensaries will produce what they call vape pens. These vape pens are doing the same thing. They're not burnt material, and so it's actually much better for you than any smoking that you would be doing, both with cannabis and with cigarettes. You can also take that material and drop it into what they call concentrates. Concentrates are where you have a pen that you can actually now get in and put that concentrate into that pen, be able to seal it up. So in essence, you're making your own inhalation pen, and you're being able to control the terpenes, the routes of administration, and also the cannabinoids that you're using. There's a number of different products that fit into that vape pen, whether they're shatter, they're waxes, and that type of thing. But I find that I'm a big fan of concentrates because what I'm able to do is use some rosin and some resin products, for example, that are whole plant, which means I'm getting all the benefits of my cannabis, all the terpenes, all the flavonoids, and I'm able to control the temperature, so I'm able to hone right in on the terpenes that I really need. So there's a number of different ways of taking it, and again, whether you're using sublingual, oral, topical, or inhalation, that's really important to do one thing: pay attention to what they call dosing. Next to choosing the right terpene profile, I believe the second most important thing to do with using medical cannabis is getting your dosing right. Go low and go slow. Don't just jump into taking that whole gummy. Take a half of it or a quarter of it. Instead of taking a whole eyedropper of that sublingual drop, take about a quarter of it. What you really want to do is you really want to start using a very low dose. You might try it for a day or two. And what's going to happen is like try it in the morning for a day or two, see what happens. You may get little or no relief. And if that's the case, instead of going from a quarter of that eyedropper, maybe increase it a little bit for a day or two. At some point in time, you're going to begin to feel, after a couple days, you'll begin to feel relief. And I can tell you, in my particular case, when that happened, it was like, wow, this is great. My pain is subsiding. I'm able to now conduct a daily activity almost close to normal, and I can feel less inflammation in things like my joints for the arthritis that I'm trying to address. Now, what you have to be careful of is if you keep increasing that, cannabis has a thing called a biphasic effect. In other words, if you use more of it, it can actually bring back a lot of those unfavorable symptoms to it. And you'll know that because you'll get to a point where you'll say, here's my therapeutic dose. That might be a half an eyedropper of a tincture drop in the morning and the evening. It might be a half of that gummy or the whole gummy. But if you start taking 2 gummies, you may not feel as comfortable as you did at a single gummy at any point in time. So it's important to really find out that therapeutic dose and also pay attention to the timing of this. Because again, tincture drops last between 4 to 6 hours. Gummies can last up to 10 hours, or oral products can, topicals work right away, but they only last for 1 or 2 hours. So thank you very much for joining us for our medical marijuana and wellness video. Check us out at our YouTube channel, Marijuana Aware, and also on our Facebook channel. Please like and subscribe to each of those, as well as join us for future webinars at Marijuana Aware. Thank you very much for joining.